Hi guys, this is Dr. Bhupesh from Dr. BKM Institute. Today discussing about the reading. So we have done few bit of questions and I will try to summarize that in one frame as quickly as possible what we have discussed so far. So I will rush it through because we have discussed them in detail already. But for the people who are not attending the class today, so telling them few important points of different questions. So first question we did today was the third one. In this, we had to find the option which is false because they are saying all of the following are true except except means so we have to find the false option. So the best key thing that I have told about this question, always mention the word F in the final exam with your pencil on your question paper because it is very important, because later on we will forget whether we have to find the true option or a false. In those question we have to find the false option. So coming back to the paragraph, so when I read the paragraph, they were saying nearly 9,000 patients have been randomized. So the last option was saying almost 9,000 patients have been involved. So again, the tenses were same, have been, third form, third form. So that means this option was true, but I have to find the false ones. The trial organizers are not yet ready to assess the data. Yes, they are not ready because it will not happen before the time. So again, this option was also true. Now, this option was really interesting. The number of the patients being entered into the trial is increasing each month, and they were saying every month 700 patients are entering. That means this number is constant. Every month 700 patients are entering. That means the number of patients are not increasing every month. They are same. That is what was the key point. The number of the patients being entered into the trial is increasing each month. No, they are not increasing because they are 700 every month. So they are constantly increasing at the same pace. They are not increasing, they are coming 700 every month. But again, this is not an easy question because you might be tricked in the exam. You feel like, yes, they are increasing, but you have to understand these two options that if this is true, that means this is something that we need to consider. So then we did false in third question. Fourth question we did was pretty interesting, was nothing to worry at all. But again, I will try to do it for all of you. Epidemiological studies in 1980s and 1990s have found that, so when I read 4% of the US population currently suffer, whereas in the first line it was given that in early 1980s it was found 4%. So the tense was past. Over here the tense was present indefinite first form. So these two tenses are not matching. Some options you can eliminate just with the tenses. So US population currently suffer, no. 4% was suffering in 1980 and 90s. They are not currently suffering. So this is eliminated. Just read the grammar, do easy things, guys, and you will find easy option. Starting cannabis use at a younger age increases the risk. Yes, this risk is much higher for daily users and the person who start using at an early age. So risk increases when the user come at an early age. So this was an easy option to be done. Interestingly, C option was little tricky as well. People who start cannabis at an early age have the high risk of becoming daily users. But if you will read this sentence, this risk is higher if the people are daily users and person who start using at an early age. Early age was had no correlation with daily usage. In the C option, they were saying if you start at early age, you will become daily users, but nothing like that was given. So this was interesting as well. So today we had very interesting questions. That is why I was recording it for you guys. If you do not understand, please listen to this video right now again, pause it, listen to it again. These two questions are very interesting and exam that can really make you sweat, and it will not be that easy when it comes to exam, but if you will do it nicely it would be damn easy. Again, in this question it is not increasing every month. In this question, risk daily users were not correlated with early age. They were saying independently this risk, that means cannabis dependence risk, is much higher for daily users and for the people at early age. But if people start at early age, they will be daily users. Nothing like that was given. They were not correlated. So these two questions were solved. This question was very, very interesting, but very, very easy. That doctor will use, first of all, use local anesthesia. If patient cannot tolerate local anesthesia, then doctor will use general anesthesia. So what is preference of a doctor? What will doctor prefer? Obviously, doctor will prefer local anesthesia. If that will not work, then doctor will use general anesthesia. So local anesthetic is preferred where possible. So this is very easy question, but again, that is trick. So you have to again understand these things. Now this was again the last question. They were asking about the pregnancy rate if in the case of split. So pregnancy rate in the case of whole embryos was 60 to 65%. In the case of split, it was 55 to 60%. That means in case of split, it was lesser than embryo. So in the case of split, little lower than whole embryos. Yes, simple. So that was the interesting reading we did. Then again, guys, we jumped on to the other part of the reading. I will take you along with me. Hang on for a second. Yes. Okay. Then I told about this reading that in exam, you will not get a reading like this because in exam, you will get reading like according to paragraph 1, according to paragraph 2. But this is very interesting and easy reading, but still sometimes people do it wrong. So that is why it is very important reading to be done. Okay. So I'm taking it along this thing. So the questions, two questions we did was this one was the first question that was asked. Very, very easy question. Next pains are more likely to be experienced by. So I went on to the paragraph that who will experience the next pain. Then it was given very easily that next pains, those people wearing the seat belt, and incidence is more in when there are front seat occupants. So front seat occupants wearing the seat belts will have the next pain. So this was like very, very easy question. But sometimes again, we do small things wrong. And now this was the last question we did. But again, in this question, the most important thing was, yes, you are right. Yes, 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 you are right. That you have to mention the word not true. That means you have to write it in your exam that you are trying to find false. And that is where I started this recording. When you get any word like any, all, must, these are strict words. You have to eliminate this word. That is why I started recording this reading. This particular, recording was being started. It was started because of this reason, because I wanted to tell you all what are the important words that you should remember if it comes to your OET reading. So this is the reading again. So words which will go for elimination. OET reading, elimination words, eliminating words. The options that you have to eliminate, and but it is not 100%, but 90% of the times, 90%, maybe more than 90%, you will eliminate the options which have words like always, because always is a very strict word. If I say paracetamol will always work, so I am making it more strict option, so obviously have more chances of elimination. Any drug can work, so word like any drug can work, so any word also will go for elimination. Must, you must do this, patient must take this medication, again will go for elimination. So words which are strict word, always, any, all of you, everyone, everything, these words are the words which majorly should be eliminated. These options should be eliminated always. But please remember one interesting thing. If I say paracetamol always works, then this will go for elimination. But if I say paracetamol does not always work, this is one of the best options to consider, because it says paracetamol may work, may not work. So this option is talking about possibility. So when always word or these words come with not, then they become the answer of choice in OET reading, because then they are talking about probability. If I say patient does not, patient may not recover, so I'm talking about possibility. So that means it has more chances of being an answer, that even after taking paracetamol, patient may not recover. Paracetamol does not always work means sometimes it works, sometimes it does not. So it gives, so it comes out of that strict zone, it becomes a flexible option. So in OET reading, the option that is flexible has more chances of being an answer, the option that is strict has less chances of being an answer. So this is the major trick of elimination. And please understand, all of you new guys, whenever you see any word like always, If it is not with not, always, everyone, everything, all, must, any strict word should be eliminated. Even the words like only, exclusively, words like immediately, words like precisely, means any word containing ly should also be eliminated 90% of the time. This is how you do OET reading easily. This is Dr. Bhupesh from Dr. BKM Institute. Please subscribe our channel if you have not, and keep watching for videos like this. Thank you very much.